So here we're looking at the pelvic joints. The first structure on the list, anterior sacroiliac ligament, that's it there, between sacrum and ilium. So anterior sacroiliac ligament. On the posterior surface, here we have the posterior sacroiliac ligament. So once again, any fibres you can see that are coming from the ilium to the sacrum will be posterior sacroiliac, and there are some longer ones and some shorter ones. The sacrotuberous ligament, again seen from a posterior and kind of inferior point of view here, coming from the sacrum, coming down to the ischial tuberosity. So this is all sacrotuberous, and then partly hidden by it, seen better from a more lateral point of view, more horizontal fibres here. That's the sacrospinous ligament, and it's attaching to the ischial spine, which is completely covered by the ligament, so we can't see it on this model. Then, above the posterior sacroiliac, so up here, we have the iliolumbar ligament. So anything that you can see, this is L5 here, any fibres you can see that are definitely attaching to L5 and then to the ilium will be iliolumbar. And then so if we turn the model around to look at the front, again, any fibres that are definitely going to L5 are going to be iliolumbar. Any that are going from sacrum to ilium will be anterior sacroiliac. Okay, so iliolumbar, anterior sacroiliac. And then the interpubic disc. Now on this model, for some reason they've got some fibres running across the front of the joint here. So to see the interpubic disc, we need to look at a posterior point of view. That blue bit there, that's the cartilage, fibrocartilage of the interpubic disc. Now then we have sacrococcygeal ligaments. So anything, here's the coccyx down here, here's the sacrum. So any ligaments that are going from the sacrum to the coccyx will be sacrococcygeal. So these fibres here are anterior sacrococcygeal. And if we turn the model over, these fibres here on the back will be posterior sacrococcygeal ligaments. Now, then we have this structure here, seen better from a more almost lateral point of view. What did we say this one was before? We said that one was the greater sciatic notch, but there we were just looking at a bone. Now we've got some ligaments in place as well, so now it's a hole. So this is the greater sciatic foramen. So please just remember, if the ligaments are in place, foramen. If they're not, then it's a notch. So here we're looking at greater sciatic foramen, and then of course inferior to it, the lesser sciatic foramen.